And we're back. Thanks very much for joining us again on another version of Eye Break from Armstrong and Small Eye Care Center here in Winnipeg, Manitoba. I'm Dr. Luke Small.
Dr. Matt LePage.
And we are blown away by the number of subscribers that we've gotten over the last couple episodes. It's incredible. So continue to subscribe to us.
Tell your friends.
And Matt's in charge of answering all the questions below, so if you do have some questions, feel free to ask those questions. Today we're talking about wet macular degeneration, also called exudative, I can barely say that word, macular degeneration. Previously we talked a little bit about dry. That's about 80% of the people. We had a superfan question asking us how many people have dry, how many people have wet. And the stats show about 80% in general have the dry version and about 20 have the wet. The wet is definitely much more severe, much more scary, much more things going on visually. And what kind of symptoms would be different, say, from your dry to your wet?
It's a dramatic reduction in vision. Instead of a little smudge, they can't see anything. There's a big loss in the middle, so you, again, having trouble reading, watching TV, driving, anything is going to become dramatically harder when you turn over to wet. What's happening with wet?
Great question. So the whole thing is, if you think about the back, this very special spot that we're talking about is this tiny little, where you see that little depression right there. So we're talking, you have to remember that the eyeball is only the size of a marble. So we're talking about a very small little area. And as we talked about with dry, we could actually, so if I can kind of blow this up. So in this little microscopic version of the retina, there's all these layers. So if you remember, to remind, the light's actually coming this way. And early on, we get these little yellow bumps that pop in right here. Those are those drusen, those age-related spots that we were calling them. Well, underneath everything, we've got a whole layer called the choroid. And as these different layers start to break down, and especially through those drusen, and there's a whole pigmented layer that starts to break down, we can get new vessels that want to grow through there. We as doctors call that neovascularization, or new vessels. So then you can almost get the geology type situation here that looks like a volcano. So you can imagine about the blood. So when we look in now, we're actually going to see some fluid, we're going to see some blood.
100%. Yeah, the blood vessels are a little bit counterproductive. It's the body almost kind of trying to save itself by sending in these new blood vessels to this dying tissue.
Which you think would be helpful.
In theory. However, these new blood vessels are thrown in on a whim, and they are very delicate. They have a tendency to break open or leak quite easily, and then you start to get this fluid in the back of the eye, which causes, again, this significant reduction in vision.
And I think it's important that we mentioned, and we'll get into another video with diabetic, but diabetic retinopathy, when it's affecting the macula, is basically the same process.
Yeah, no, exactly.
Absolutely. So then some of the analogies, we love our analogies here at our eye breaks, and one of the great ones we had was?
The wet AMD analogy.
Yeah.
So the best comparison, everyone's spilled some kind of a fluid, coffee on your magazine, or spilled your water on the newspaper, whatever it may be. When that fluid then dries, that paper is no longer a nice smooth piece of paper, right? It's
don't have the nice little layers going through.
No, exactly. So, or say, take a deck of cards, put it in a pail of water, pull it out. When those cards dry, they're going to be very unorganized, whereas they used to be just very finely organized cards. The back of the eye, the retina, has 10 main layers. As they get wet, obviously they get very disrupted, and now you don't have that very fine architecture that would normally transmit light straight through. Very unorganized tissue, which again causes a reduction in vision.
10 layers. Wow. You're smarter
I'm
than me.
not going to list them.
We won't make you list them, Dr. LePage. So one of the things that we want to talk about was some of the treatment for wet macular degeneration, which is always a little bit scary because there's specific medicines, and over the last few years, and even some newer ones coming down the pipe, that we need to get inside the eye to actually reduce the vasculature, these new blood vessels from growing. So you can imagine if we can reduce these new vessels from breaking through and get them to recede, that macula then, or your deck of cards, can then come back into those fine little layers. So how do we get that medicine into the eye?
Well, injections, of course, which everyone hears that and thinks, oh my God, eye injections. It's not that bad. Talking to patients or surgeons that have done this, we don't do this. We refer out to a great retinal team that we have in Manitoba. But the surgeon will have you look off to the side. They'll use a very, very small gauge, as well as not very long needle, and you look off to the side. You don't even see it coming. It goes in the side white part of the eye, which there's not a lot of feeling or sensation in anyways, so you don't even really feel it. Maybe a little bit of pressure from the needle. They inject a small amount of anti-VEGF medication, which prevents this new vessel growth.
So interesting, the sort of side story with this is that this was originally, especially the first one that we were able to inject into the eye, or they were able to inject into the eye, actually came from colon cancer. And colon cancer has the same process, lots of new vessels growing in. And a lot of people at this time, this is probably 15 years ago, I would say around then, that they said there's no way we can inject that into the eye, but basically the same process. So someone tried it and it worked, and actually for the first time, people with wet macular degeneration actually regained vision. And this is the big one. We get a lot of people with advanced dry macular degeneration that we can't do anything about other than talk about those modifiable risk factors.
Yep.
But they hear about their friend who went and had needles. So we get questions, I think you, Matt, as well.
Every day.
Yeah, hey,
Yeah.
I want those needles to be able to get that drug in there to make my eyes better. But you've got to have the wet version before they're going to decide to do it. The other final question that comes up is some people will say, my retinal specialist stopped injecting me. Why did he stop injecting
Could
me?
be good news or bad news. Generally, probably worse. If they're no longer doing injections, either think that A, things have healed up, sealed up, there's no new vesicle growth, which is not as likely as they figure that's end-stage treatment. There's no further benefit. That
Usually there's been some scarring
Yeah,
there that's happened, so
snapped
you
in the
can
back
keep
of the eye.
injecting and nothing's going to happen. So usually what we're trying to do when we send those people out, we're hoping that they get seen within probably about a week or so, ideally. And that's usually how it goes here in Manitoba. We're fortunate enough to have some, as Matt said, a great retinal team to be able to take care of that. All right, thanks very much for tuning in once again, and don't forget, be wise.
Take care of your eyes.